Mr. O'Carroll, take one.
Fibroids are benign growths of the uterus. They originate from the muscle of the womb, and they can occur inside the cavity of the womb, in the muscle itself, or on the surface of the womb. They occur in 25 to 75% of the normal female population, and they are more common in Afro-Caribbean women. If you have an early menarche, which is when the periods start, or a late menopause, it means that the womb is exposed to more estrogen, and thus you're more likely to have fibroids. If you don't have children, you're more likely to have fibroids. If you're overweight, you're more likely to have fibroids, simply because when you're overweight, you tend to have a slightly higher level of estrogen. The symptoms with regard to fibroids are quite varied. Some patients actually have no symptoms, and fibroids can be found incidentally. Others present with common symptoms such as heavy periods, painful periods, bleeding in between periods, the feeling of a fullness in the tummy. You may feel bloated. You can have frequent urination, and sometimes because of the pressure of fibroids, you can also experience constipation. Also, depending on the location of the fibroids, some fibroids can lead to infertility. At my clinic at the Hospital of St. John St. Elizabeth, I see a lot of patients with fibroid-related problems. They will come for their initial consultation. I will take a detailed history, I'll examine them, and that examination will usually include a pelvic ultrasound. For most patients, on that pelvic ultrasound, we can diagnose what fibroids they have, where they are, and the best treatment options. Depending on their initial symptoms and the type of fibroids we've found, it can be a watch and wait, or medical treatment, or surgical treatment. The surgical or medical treatment we undertake in the hospital. We have state-of-the-art theatres at the Hospital of St. John St. Elizabeth, and we perform the most advanced techniques and methods for treating fibroids. Not all fibroids require treatment. Fibroids are so common that you may find them incidentally. In the absence of any symptoms, they don't need to be treated. We do often recommend we monitor them because fibroids are estrogen dependent, and they will generally grow with time. The Hospital of St. John and St. Elizabeth has world-class and state-of-the-art surgical facilities, and that's what I want my patients to be able to benefit from. One of the really other important aspects of the hospital is we are known for the quality of the nursing. And being a doctor, it's not just about my surgical ability, but patients need to be cared for. They're admitted to the ward, they receive excellent care for the nurses, and even after I've operated on them, that care continues. And I've watched the hospital evolve and grow with significant investment, making sure that we remain innovative, relevant, and the best hospital in London.